So I have been given a topic, role of private sector in tackling lung disease. So as we know that private sector is a very large healthcare sector with almost 60% of health expenditure coming from the private sector, and this sector includes big corporate hospitals, medium small nursing hospital homes, individual practitioner clinics. Now there is a concept of polyclinics, and new addition is the telemedicine via various platforms like Practo, and home based healthcare is another new addition post COVID, which has gained lot of momentum in providing home-based healthcare to especially to the elderly patients. So this sector caters to large segment of population, and it is a first point of contact for large number of patients, including rich, poor, urban or rural segments. And people are more inclined towards the private sector because of the perception. They have their own individual perception of better quality treatment, shorter waiting period, thus averting loss of wages, ease of access to diagnostic with short turnaround time, less documentation and immediate treatment. Here, I am not promoting any private sector. It's just that I have been given the topic, so I am just highlighting you the how the private sector can also play a major role in your public health programs. So this national health policy has now has taken an objective to align the growth of private healthcare with public health goals, with reliance on the strategic purchasing. And Niti Aayog also announced public-private partnership model to link new and existing private medical colleges with functional district hospitals. So moving together with the private sector to expand access to care is the main goal. So now we have your our TB Mukt Bharat Abhiyan launched by our Honorable Prime Minister with the goal to eliminate TB by 2025. And TB Mukt Bharat Abhiyan is a very beautiful concept where the private-public partnership has cropped, and to take a challenge that how we can involve private sector in defeating this disease. The idea is to detect, treat, build, and prevent. So public-private partnership has already been done in this segment of the communicable disease, where the public-private interface agencies were involved in engaging private healthcare providers on behalf of National TB Program. So there is a program called JEET, that is a joint efforts to eliminate tuberculosis, where your JEET coordinators coordinate with the private practitioners and your hospitals to provide high-quality diagnostic, to report confirmed TB patients to the program, to provide patients with anti-tuberculosis drug and necessary support for adherence to treatment. And now there is a mandatory protocol for every private practitioner to enter the data of a TB patient in the Nikshay portal, so that the government can track the number of cases and they monitor their drug treatment and follow up. And now recently, for drug resistant tuberculosis program, private sectors and bigger hospitals have taken a challenge that they will provide a treatment to them according to the national policies, and there is some memorandum how these hospitals are to proceed with such patients. So initially the target was 1 million plus private sector TB notification in the year 2020 and 21, and as per the analysis between 2012 and 2018, 47% of TB notifications were from the individual clinics, 48% from the private hospitals or medical colleges, and 5% from the pharmacists. But yet, more stringent and regulation is required in this aspect, because many practitioners are still not reporting TB to the government programs. So this is the Kerala government initiative, where they have taken a comprehensive tuberculosis program and among the private partner, your public-private partnership model. So they have created a STEPS, which is a single window system in a private hospital, ensuring all public health actions to all. Private hospital consortium was set, where there is a consortium of the hospital managements, how they will establish the STEP program, policy support review, and coalition of the professional medical associations. So STEP is the system for TB elimination in the private sector. So all TB patients, once reaches to the hospital, they get a single window for the notification, then guidance and linkage with your JEET partners, and through which the patient gets treatment and diagnostics free of cost. Now, leveraging lessons from the COVID-19 pandemic. COVID-19, as we all know, when it arrived, when it touched our country, nobody was aware what will be the disease, and we were not prepared at all. But COVID crisis may be looked upon as a historic opportunity for reimagining your public health system, as well as engagement with the private healthcare moving to majorly expand public health services and to socially re-embed private providers. So in the initial phase of the pandemic, private sector was showing non-uniform response. They were not ready to take up the patients, and they were not actually prepared and not equipped with the COVID-19 treatment facilities. And there was a fear among the doctors and the staff. And there was a also, when they started taking up the patient, there was unregulated pricing. So how the capacity building was done? ICMR along with the ministry onboarded certified private labs for the COVID testing, and the COVID portal was created where there was regular entry of all the tests that were done, including the positive patients, so that surveillance can be done. And your rapid platforms like Gene Expert and TrueNANS were approved for COVID testing, so that a small private lab can also run the facility for diagnostics. There was real-time data sharing on the COVID portal. So this helped in tracking, surveillance, and your isolation. And there was a participation in quality assurance program and your INSACOG, that is a genomic sequencing of the positive samples through which we got an idea about the Omicron or your Delta strains. And later on, more and more private setup were able to run the COVID facility. Yes, government stepped in for providing rate capping, oxygen backup, and a regulated medicine so that all patients or your all we have a major segment of population in our country, so that they were able to take treatment even in the private hospital. And vaccination drive was another success story. Like private hospitals were also allowed to give COVID vaccines, and there was a COVID portal, and various vaccine options were available in the private hospitals like Sputnik, Covishield, and Covaxin. Now, some of the private hospitals came up with the state-of-art facilities like ECMO and the lung transplant. Obviously, these methods and these techniques are very costly affairs, but those who were able to afford and those who were eligible for these treatment, some of them was able to survive. Now, as we all know, we are discussing about the lung day and your lung tuberculosis and your tobacco programs. We all know that lung cancers are increasing, and as you see that the chronic respiratory disease is the second number after your ischemic heart disease. And now there are more and more fungal infections that are cropping up, especially the respiratory fungal infection, chronic pulmonary aspergillosis, which is related to a post-tuberculosis or your post-COPD and post-lung chronic lung disease, is a new entity which has now taken attention. And this is a very beautiful paper which has shown the burden for this disease. And this disease is actually a neglected disease, but it is a public health problem. And apart from the CPA, there are other lung infections, fungal lung infections that are cropping in. So respiratory fungal infections are common in diabetes, asthmatics, and chronic lung disease. And private sectors are equipped with all latest diagnostics and treatment. Post-mucor outbreak, advanced mycology laboratories has been set up in all various parts of the country, but still more to go. And since most of the patients coming in the privates are diabetics and asthmatic, they seek their treatment from private providers. So the doctors who are equipped with diagnosing and know more about the respiratory fungal infections are able to pick such kinds of infections. Now we have another challenge of AMR in our country. So there is a sustained rise in antimicrobial resistance in India. This is an ICMR study. India is facing a pandemic of antibiotic resistant superbugs, or it is a global health emergency. How this is related to the your lung health? Because as you know that there are respiratory viral illnesses. Now, when the patient comes with the respiratory viral illnesses, all doctors are in hurry to provide antibiotics, whether it is required or not. And there are your pneumonia cases and your severe pneumonia cases which are going on the mechanical ventilation, and they are being treated with inappropriate or injudicious use of antibiotics. So antibiotic resistance is not only a medical problem, it is actually a social problem, because increasing antibiotic resistance will add cost to your medical treatment, and it will lead to it will affect your economy and health economics. It has been estimated now at this time we are dealing with 7 lakh cases of antibiotic resistant infections. Deaths are due to the antibiotic resistant infections are around 7 lakhs, but it has been projected that by 2050 the number will reach to 1 crore. So now, as we are also discussing about the vaping and your tobacco and your cigarette smoke is also known to increase the superbug antibiotic resistance. Your cigarette smoke changes the oral microflora of your body, that is, it changes your oral microbiota, which in turns have an effect on immune system, and this changing immune system makes the person more prone for the infections. Apart from this, your cigarette smoke vaping damages your lungs or changes your lung health and making person more prone for infections. So yes, we need harm reduction strategies. So how we do in our private practice, then whenever a patient comes, we try to indirectly convince them, motivate them for cigarette smoking. Like I treat HIV. When a patients of HIV come to me, I always tell them that while that these HIV drugs will not affect your body or your HIV virus if you keep on smoking. And I write in the big letters, no smoking. So in fear that their HIV treatment will not affect them, they try at least to quit the smoking. Similarly, for your heart patients, whenever they come to any cardiologist, they also suggest and counsel and motivate them for your harm reduction strategies. So in this, indirectly, we are trying to motivate the patients for quitting smoking or your alcoholism habits. So behavioral change is done by these methods. Now, as we know that AMR is another health emergency, and the Kerala government has another taken, I could not show that paper because of this technical issue. They have taken a public-private model. So over the period of 7 years, they create, on basis of that public-private model, they created a diagnostic surveillance and infection prevention control surveillance program through engaging various private bodies and your professional societies. So if Kerala government can do this, any state government can do. Apart from it, in private sector, we are doing adult vaccination. So the children immunization is very well developed in our all public healthcare system, but adult immunization is grossly neglected. But in private practice, infectious disease specialists are taking up with this challenge of establishing adult vaccination center. Now these adult vaccinations, especially pneumococcal, which is important for the lung health, these are being taken up, and now we have a new zoster vaccine. Now these vaccines are not easy to give to any adult patient because adults are suffering from lot of chronic disease like diabetes or autoimmune disease. So it has to be seen when the patient is not immunosuppressed. So right timing of vaccination is important. So that challenge is being taken in the private sector. But yes, if that we are not talking of the wellness, so soon it can be implemented in the government programs too. So this is how we are private sector is lending help in your public policies. But yes, there are a lot of challenges. Private doctors are dependent upon the hospital management policies, so they cannot take their own decisions, and there is lack of motivation amongst most of the private practitioners, and there is lack of public sector engagement with the private. More and more public private partnership should come up so that we can have lot of data and evidences of basis of which we can make a guidelines. So for suggestions, we can make a registries. For example, we make a fungal registry where we can take diseases like chronic pulmonary aspergillosis and we start collecting the data, symptoms of that patient, how to treat. So in this way, we will be able to generate our own Indian data. So this is all about. Thank you.